The kid with cancer should also be involved in the whole process of choosing treatments and all that. It's them that's being affected directly, and they should at least get a say.
You may want to watch when you get an IV. You may want to know exactly what's going to happen during a lumbar puncture, or you may want to know nothing at all except you're going to go to sleep and the test is going to be done and you're going to wake up. And so really think about what aspects you want to know and make sure that your family knows.
I'm Simon Hajar, and I was diagnosed in May 2010. I was treated with surgery and transtibial amputation on my right leg. My parents probably took it rougher than I did. They would be constantly worrying about everything, and my sister still to this day thinks that I've just broken my leg and it needs healing. At first I wasn't too sure if I was going to end up moving around again, but after a few months of practice I'm moving around just like before, sports, everything.
So this is the position you're going to lie in each day that you come.
She had chemotherapy and she also had radiation, but she was diagnosed again 6 years later.
And that whole experience was so intense because I felt like I couldn't breathe.
So radiation therapy is used to treat cancers and tumors in children. Radiation is like a high energy X-ray that helps destroy the cancer cells in their ability to divide and reproduce.
I noticed that the chemotherapy really messed with my skin complexion. It kind of washed me out.
She was in the hospital majority of her treatment just because of the nausea, dehydration, and
for radiation, unlike chemotherapy, radiation only affects where we give it. So if we are treating Hodgkin's lymphoma, we would only be seeing side effects in the area of where the Hodgkin's lymphoma disease was.
I had chemotherapy for 4 weeks, and then I had radiation for a month, and then in October I was re-diagnosed, so I had more intensive chemotherapy.
The chemo would be put in my body through a hole in my arm, and it would basically go in and try to fight every single cell that was in my body, including the good cells. But I knew that even if my good cells were being gotten rid of, that means the bad cells are also being gotten rid of as well.
I had 2 options, and I chose the one where you only come to the hospital 1 day every 3 months because I really, really wanted to still go to school, because it would be my first year in college. So I really wanted to make sure that I wasn't going to miss out on that first year, because all my friends are going to college too. I don't want to be at home.
I had broken my leg. I was forced to stay in the hospital for about 6 months straight. So I was in traction, so I couldn't move from the bed. And it was a big adjustment, but I know that they were kind of worried that I might have anxiety before procedures since I was doing so many surgeries, and the MRI procedures I'd have to be asleep because I had metal in my leg, so it was just a lot of different things. There were some complications after it. I had to have wound debridement, so it was a painful procedure, and they'd have to clean the wound every second day and put new dressings on it, and it wasn't more of an anxiety thing, but it was just really painful. And what I used to do was I'd put on my earphones and I'd blast the music really loudly, and I just let them do the procedure while I was listening to music.